Brian. Joining me now with the latest from Queen's Park and the province of Ontario's response to COVID-19 is our member of Provincial Parliament, Jim McDonell. Welcome back, MPP.
Well, it's always good to be back and get a chance to speak to the public.
Now, first off, as of today, the Ontario state of emergency has been extended till the end of June.
Yeah, of course we're a distance away from getting through this pandemic, so it just makes sense. The idea of having to renew this and debate it every 2 weeks just doesn't make a lot of sense. So it is in place till the end of June. We hope to be making it's a month's time, 30 days. We're hoping to make a number of new decisions on businesses opening up, and I know our office is getting lots of calls wondering about things such as hairdressers, church services. So we're looking to get to that next step as quickly as we can.
And it's important to note that the extension of the state of emergency doesn't mean that some of those announcements can't come throughout the month of June.
No, it just allows the Premier to make those decisions by regulation without having to go back to the legislature. So I think it's important to have that so we can make those changes quickly and when it's timely to do so, and not having to coming back and debate the different openings, different conditions that come up. We see lots of things changing daily, and we're just hoping we can keep on the trend where things are staying stable, and we work through this pandemic. And with the cooperation, we've had great cooperation, especially in our area and rural areas where the numbers are low, and we're looking at some different approaches to opening up the province in different areas.
And some good news that came in today in Premier Ford's address. The Ontario Together Fund has been a very good success, and over $200 million in PPE was able to be purchased.
Yeah, this equipment is so important to getting our province back on, whether it be personal support equipment for hospitals or long-term care, and for businesses as we move ahead. It will not be business as usual for some time, so we need to make sure we have the protective equipment so that more of our businesses can open up, whether it be a Canadian Tire or a dentist. This equipment has been in short supply, so as we get more of it, it's one of the issues that really determines just what can be opened.
And another question that's been popping up, MPP, is in terms of potential regional approach to the reopening process. We know that right now over half of new cases seem to stem from the GTA. So the idea has been bandied about the potential of offering regional approaches to reopening.
Yeah, the Premier announced that last Friday, I believe, that they'll be opening the province in regional areas. So we want to make sure that we keep our numbers down so that we can be one of the early areas to open. It's good news, but of course you have to, I guess, make sure our behavior warrants that through the low number of cases. And so far we've done a great job. And just asking our people to keep up the vigilance. If you go out, make sure you're able to practice safe distancing of 6 feet or more, and if not, wear a mask. And of course, always the frequent washing of your hands, and just being careful.
And another key facet of the reopening process is, of course, testing. And we've seen Ontario's testing numbers almost skyrocket lately. They're 17,000, 15,000 a day. So let's talk about Ontario's testing strategy.
Well, we're looking to get as much testing as can be done with people, especially if you suspect you might have been in contact with somebody, or if you have symptoms, because then you're most likely to test positive. We want to make sure we catch all the positive cases that are out there. And if you're some concern, even though if you're not serving or exhibiting any symptoms, we're looking forward to having you come in as well. We hit over 20,000 over the last few days, so it's the more numbers it gives us a better picture just what the situation is out there, and just how many people have the virus.
And I believe it was the last time we spoke, MPP. We spoke on the situation in our long-term care homes. The province had just released the report from the military on the state of some of them. We know that there will be an independent review now in July, and as well, the program for the incident management system has been extended as well.
Yeah, we're look forward to starting that commission in July, so we get answers back relatively quickly. I mean, our government since coming in has been increasing the number of available homes, replacing many more. I think we've approved 8,000 new beds and approximately the same amount or more of redesigned or replaced beds for beds that were not meeting, the new guidelines. But it takes a while. These homes are not under construction yet. They're in planning, financing. There's a lot of work to be done before the shovel's in the ground, but we're hoping to see those activities take off. It was our commitment of the 15,000 in the first 5 years was because we knew there was an urgency around this. So it's really about now looking back at, is there a problem with the design? I mean, capacity was a major issue, but we also need the second most serious issue is the labor shortage when it comes to long-term care. We need more people to work, and we had been working with colleges to increase those numbers. But we're going to have to get a lot more people going through the programs and being available for work in long-term care, and hopefully the study will show us just what needs to be done. It's part of it's pay, part of it's just making sure students coming through know that it's a viable and a great career.
Absolutely. On that note, MPP, thank you so much for joining me for this provincial update.
Well, thank you, and again, remind everybody to stay at home if possible and just play it safe and look after yourself and your families.